Good afternoon and welcome to the SRTR's webinar on SRTR reporting for organ procurement organizations, metrics, risk adjustment, and available tools. My name is John Snyder. I serve as the Director of Transplant Epidemiology for the Scientific Registry of Transplant Recipients here operated at the Minneapolis Medical Research Foundation. This webinar is geared toward understanding the various metrics that the SRTR puts forward for the OPO community. I'm going to talk a bit about risk adjustment and how the models work when we try to adjust for donor characteristics of the different OPOs, and just talk through conceptually how we think about some of these metrics. I'll conclude with some of the tools that we have available, along with some thoughts about the interplay between the OPOs and the transplant programs. Before I jump right in, you should be able to find a Q&A area on the WebEx. At any time during the webinar, please just type your questions there. We will have a Q&A session at the end, so we will be looking through those as we go, and we will try to address as many as we can at the end of the webinar. I'd like to begin by just reviewing briefly the SRTR's role in the transplantation system in the United States. The SRTR is if you look on the right of the slides, I'd say a sister contract to the Organ Procurement and Transplantation Network. Both are contracts within the Division of Transplantation of the Healthcare Systems Bureau of the Health Resources and Services Administration in the U.S. Department of Health and Human Services. The OPTN, of course, is operated by UNOS in Richmond, Virginia, and they're running the nuts and bolts of this system and the waiting lists and the matching system and getting the organs where they need to be. And the SRTR's role, I will highlight on the upcoming slides. Our mission is really to provide advanced statistical and epidemiologic analyses related to the solid organ allocation and transplantation system in the U.S. in support of the U.S. Department of Health and Human Services. And I've highlighted just three major deliverables. We, of course, support the OPTN committees with advanced statistical analyses. So we have a series of number of biostatisticians, epidemiologists that are doing analyses for those committees to help them in their decision-making process. We also are charged with evaluating the performance of both the transplant programs and the OPOs. So that's what today's webinar is, of course, focusing on, is how do we do that for the organ procurement organizations. Specific language from our contract that I just wanted to highlight. One of our tasks, which is task 3.9.1, for those of you who want the specifics, the contractor shall develop PSRs on the performance of transplant programs and organ procurement organizations, OPOs. PSRs here stands for program-specific reports. We typically make a distinction between our program-specific reports in operation versus our organ procurement specific reports, which we refer to as our OSRs. The specific language in the contract is that we shall disseminate for free over the internet timely and accurate program-specific information on the performance of transplant programs according to, you'll see the paragraph there of the OPTN final rule. The OPO information shall include information on organ donation, recovery, and discards, and both OPOs and transplant programs with better or worse outcomes shall be identified in the reports. And I'm going to highlight a few key metrics for the OPOs and where you can find those in our reports as I go along. So I've touched on a bit of our outline, but I will start by just how do we conceptualize the OPO metrics. I'll touch on risk adjustment. How do we account for differences in donor populations across the different OPOs? I'll touch on the association between the OPO metrics and the transplant program metrics. I will touch on the tools available to the OPOs. We have some new ones that have recently been made available, so I'll highlight those. And we'll conclude with a question and answer period at the end of the webinar. I'm going to start with a poll. I always like to see what kind of folks we have listening in. So I'm going to open up the poll. The first question here is just to describe your relationship to the field of transplantation. And I will open the poll now. If you could just, you should see that poll on your screen. we just like to understand who is listening in so that we can better target our discussion and future webinars even. We'll give this a bit of time to complete. Looks like most of the answers are coming in. We are up to about 85% complete. A few more seconds. Great, thank you. I've closed the poll. Not surprisingly, the vast majority of people listening in are from Organ Procurement Organizations, but it is nice to see that we have a few from transplant programs. We have some transplant administration represented, other professionals in the field of transplantation. So that's great. We hope that no matter if you're at an OPO or you're just an interested party or at a transplant program, we hope you gain some good insights from this presentation. Second question is we just want to understand how many people we have listening in. So I'm going to open this poll. If you could just let us know if it's just you listening in or you've got a number of people with you in the room. Helps us to understand just the reach and planning for future webinars, how many we can expect. So we'll give this a few minutes here to complete. Looks like most responses are coming in. Fantastic. I will close that poll. A few seconds here left. A number of singles, but we have some folks with a number of people in the room with them. So welcome to everybody. Great. Jump back into the discussion. I always like to start with some happy news or good news, and I wanted to put up the yearly trends in deceased donors over the past 7 years. You can see here the blue line at the top are the number of deceased donors according to the most recent data the SRTR had available to us. So you can see since 2013, 2014, we've been seeing this steady increase in deceased donors. We had 9,979 according to our latest data during 2016. The lighter blue line below are donors that actually had at least one organ transplanted. And then you can see the recovered but not transplanted down there at the lower line. So if we translate those numbers into sort of year-on-year percentage changes, I think been some good trends in the last few years. The jump from 2015 to 2016, we saw almost a 10% increase in deceased donors between those 2 years. So I always like to congratulate my colleagues in the OPO community. I think there's obviously a fantastic group of people doing very hard work for the system, and so I think this is an exciting change. I would just highlight that against the change in living donors, which has been relatively flat over the past 7-year period, as shown here by the light blue line. And if you just look at gains in donors from 2014 through 2016 by the donor type, here you see that the deceased donors went up 8,600 up to 9,979, which is a 16% jump there. The living donors jumped 2.7% in that same 3-year span, for a total of a 10% jump overall. So let's go on to conceptualizing and capturing the donation process. I like to think of these as my circle diagrams, but I like to highlight how we think about capturing a complex process. We all know that the process of deceased organ donation is a complex one with many steps. So how do we go about thinking about that? This is the way I conceptualize it. We all know that within the donor service areas, which we refer to as DSAs for short, if we start at the outer circle, circle A, we have deaths that occur within our donor service areas that the OPOs serve. Some of those deaths, a subset of those deaths, would be in-hospital deaths. Those are deaths that are reported to the OPOs, mandatory reporting to the OPOs. We do know that only a subset of those deaths are ventilated deaths, and I'll just say that these circles aren't meant to be to scale, if you will. They're just meant to illustrate an idea. Ventilated deaths are, of course, the deaths that would allow for deceased donation to occur. But then again, only a subset of those are what I would call, in quotations here, a potential donor. I'll come back to that idea, but the thought here is that not all ventilated deaths would meet the criteria for someone who could actually go on to be an organ donor. But how do we define that potential? I'll come back to that in a minute. Within those, we have designations of imminent and eligible deaths that the OPO community is familiar with. Eligible deaths meeting a certain set of criteria, not having certain exclusion criteria. These are typically thought of as donors who most would agree would lend themselves to becoming deceased organ donors. Eligible deaths are those that also meet the definition of brain dead within that state. Imminent deaths, those are deaths that have those characteristics of the eligible deaths, but for whatever reason have not yet been declared brain dead. Then within that, we have three circles G, H, and I, which are offset, which I think is a key thing for us to think about. We have the subset of these deaths that are authorized. We do know that we can get donors that are outside both the eligible and the imminent pool. So, for example, donors over the age of 70, DCD donors would not meet the eligible death criteria, which is why these circles are offset, because they can reach out into those broader bands of deaths. Those that are authorized, either through a registry or family authorization. Of those, we have those that actually go on to become deceased donors. We typically define that as having at least one organ procured for the purpose of transplant. And then of that circle H, we have another subset where those organs are actually transplanted. So that's the difference between those being recovered and those being transplanted. So this is the process as a whole. I think when we consider metrics, what we like to think about is how do we compare the size and shape, location of these circles, one circle to another. We can pick off certain circles here and create ratios by comparing the size of that circle in reality to the size of the broader circle, which is how we've thought about OPO metrics as we go. So I'm going to highlight two concepts before we actually get to specific metrics. The two primary metrics that the OPOs are typically judged by as on the left here, how often do potential donors become actual donors? We typically at the SRTR refer to this as conversion. In other words, we're comparing that circle D to the size of circle H. In other words, how many potential donors are becoming actual donors? Again, we don't have a very clear definition of potential, but I think that we would all agree that this is the metric that we would like to arrive at. We want to know of those donors that die in a manner suitable for donation within your donor service area, how many of those go on to become actual donors? We would like that percentage, of course, to be high, and so that's one component of the process, is getting those potential donors to be realized as actual donors. And then subsequent to that, once we have an actual donor, we're now within the broader circle H, how many of those organs from those donors are successfully transplanted? We typically refer to that as yield. I've heard other names for that type of a metric. But so we have these two sets. We have on the left donor conversion, and we have on the right donor yield. And I'm going to walk through how we calculate these things today, talk a bit about how maybe we would calculate them in the future if we had better data or more granular data available to us. So I'm going to start with this left one. How often do potential donors become actual donors? As I said, we can just take the ratio of these two circles. So we're going to look at the data for your OPO, your donor service area, and say how many potential donors were out there and how many of those became actual donors. If we just simply take the ratio of those two, just the number of donors divided by the number of potential donors, we would have what we would think of as our conversion rate metric. So this is sort of the ideal state, what we would really like to get at, what we are trying to measure. Of course, we don't have a great definition of potential donor. This has indeed been the source of much debate in the OPO community and the OPO committee, even within UNOS and some of the special projects that UNOS was engaged in recent years under the leadership of John Rosendale. So I think this is great potential here to arrive at a better definition of potential. But what do we do today? We would like a future donor conversion metric that maybe is more granular. In other words, it's outside of that eminent and eligible definition, but it captures a broader pool of potential. And an example that has been sort of floated out there is that age less than 71, no active cancer, not HIV positive. Can we arrive at that number of ventilated deaths within each OPO that meets that broader definition that's out beyond eminent and eligible? If we could do that, I think the bonus here is that Circle H actually fits wholly inside Circle D. When we limit our denominator to circles E or F, the imminent or eligible deaths, portions of Circle H reach outside of that circle. So I think it's that's sort of a wish list metric, what we'd like to get to, but we don't have that today. I think that there's potential to get that in the future. But what do we do today? I mean, the current SRTR eligible donor conversion metric is limited to the eligible deaths. So we call that our eligible donor conversion metric. And simply what we're doing is we're starting from that eligible death circle, Circle F, and we're looking of those eligible deaths, how many of those became what we would call eligible donors. And it's a distinction that we are only looking within the eligible death pool. Of course, there's a portion of that circle that reaches out into the imminent death pool and indeed out beyond that into the potential donor pool, Circle D. So it's not ideal, but it is what we have been reporting for some time. This slide shows you where you can find this information in our OPO-specific reports. So if you go on the SRTR website and you look under the OPO-specific reporting section, which I'll show you a bit in a moment, where you can find that, Table B1 in that report shows you this conversion metric. So the eligible death count is there. I'm using Colorado's OPO here as an example. So this is CORES, and the deceased donors meeting the eligibility criteria Donor Alliance, 104. They had 130 eligible deaths, and if you just take the ratio of those two, 104 divided by 130, you would arrive at the observed donation rate per 100 eligible deaths, in this case 80. So these are that is that donation conversion rate metric. Right below this table in the report, well, before I get to the figure, if you take that observed donation rate and divide it by an expected donation rate, expected conversion rate here, you arrive at the standardized donation rate ratio. So in this case, 80 divided by 79.2 arrives at 1.01. So this is a measure of what is your conversion rate compared to expected. In this case, when we look at expected donation rates, we don't have a lot of information we can adjust for in terms of differences across the OPOs, but we do adjust for the eligible deaths, age, gender, race, and cause of death. So when we take those things into account, we're looking at, compared to what other OPOs are doing around the country, what would we have expected to happen within your OPO? You can see in this case, because 80 is very close to 79.2, that their conversion rate ratio is very close to 1, which means they're getting the number of donors that's about consistent with what the other OPOs are doing around the country. Right below that table, there is a figure that just shows you where your OPO sits in relation to your peers. This is stratified on the x-axis at the bottom of the screen by the number of eligible deaths within your DSA. And so this is meant to be able to show you your OPO relative to your peers of similar size that would be near you from left to right. You can see in this example, Colorado is sort of right in the middle at the 1.0 line, and you can see where the other OPOs fall there. So that is the first conversion metric. The second metric that the SRTR puts out there is this yield concept. As I've shown before, it's the ratio of the number of organs successfully transplanted compared to the total number of donors. And again, when we say a donor here, we're talking about some a person who had at least one organ recovered for the purpose of transplantation. So this just simply shows where you can find this information in the OPO-specific reports on our website. Table C3 presents the yield metrics. It's important to note at the top of the screen here on the top in the title of where it says Table C3, Observed and Expected Organ Yield. This is a 2-year period of time, so we're looking in this case the most recent reports from January of 2015 through the end of 2016. That 2-year window advances 6 months. Every 6 months. We release these reports in January and July, and so in July that cohort will advance 6 months forward. In the top left and the next line down, we do show the number of donors within that OPO, so 273 in this example over that 2-year period. I've highlighted just to draw our attention to the heart column here, but the interpretation of each of the columns is the same. We start by showing the observed number of transplanted organs, which is 108. We derive an expected number of transplanted organs, which I'll talk about more as we get into the risk adjustment discussion. We then convert that to the observed number of transplanted organs per 100 donors and the expected per 100. And then we have the observed per 100 minus the expected per 100, which in this case was 3, and the observed to expected ratio 1.08. And a statistical test here about whether that is significantly different from 1. A lot of numbers there. I'm not going to highlight each one, but I will say that these are the data that the MPSC within OPTN uses when they are reviewing OPO performance. So these are what we call our yield metrics. So they're looking within each of these columns. They currently aren't concerning themselves with the intestine column, although we report the intestines. But they will review the heart, the kidney, the liver, the lung yield, and the pancreas yield as well. And the leftmost column where it says aggregate organ, this is simply the summation of the other organs. In other words, if you got 4 out of 7 organs transplanted or such, that's just the total sum of organs transplanted in aggregate for the donor. That table is followed by a similar bubble plot that I showed you before, simply for the yield metrics for each of the organs. So again, you can see where your OPO falls in relation to your peers for each of the specific organs that are being evaluated. Before I move on from the yield metric, I'll just note that CMS has also adopted the yield metric in their performance evaluation reviews. One notable difference is that CMS is using a 3-year cohort of donors rather than the 2-year cohort of donors reported by the SRTR and used by UNOS in their evaluation of the OPOs. Just so you're aware, they're using a very similar concept, but they have broadened out the years in which they are evaluating the OPOs. I've covered a lot there quickly. We do have a guide available on our website at srtr.org under About the Data. You will see a guide to key OPO metrics. And this highlights a number of the things that I've just reviewed for those different metrics. And the OPO reports themselves, I'll just stay on this page for a moment, are found under the Reports and Tools. And you will see a link there for the Organ Procurement Organizations specific reports. And that's where you will find the reports that I was just highlighting. So let's get into the risk adjustment piece. How do we adjust for differences in donor populations across the OPOs? I'm going to focus the discussion here on the yield metric. And I'm not going to get into the statistical detail per se, but try to point you to some resources and show you a couple tips for understanding and interpreting the models that we are using. So the first thing I want to point out, under Reports and Tools, I've highlighted in blue here, you will find risk adjustment models for the OPOs. That is where you will see the current models that are being used in the evaluation process. And this is an online interactive tool that lets you explore the models themselves. I think most people are simply interested in what is in these models. In other words, what is the SRTR adjusting for when they make these comparisons? And then I'll show you some tips about how you can understand how the adjustment works. I think it's useful for the OPOs to understand in fairly straightforward terms how they can look at these risk factors for yield and understand how the adjustments are performed. So I'm going to walk you through that tool a bit. If you do go to that tool, you will see, here's just a screenshot of what that looks like when you first open it. You get this SRTR OPO Yield Documentation tab. I'll highlight a few things here. The first part here lets you choose 2 different versions of the models. We update them every 6 months. So the tool allows you to look at the current one. It will default to the current set, which in this case was the July 2017 report. If you wanted to look backwards 6 months to the prior report to evaluate how things may have changed, you can select the one prior. And of course, if you had a need to review models even before that, we do, of course, archive those here at the SRTR, so just simply contact us and I'll give you contact information if you needed to go back further than the most recent 2. Below that, it lets you choose which organ you're interested in evaluating. We have separate models, separate risk adjustment processes for each of the organ types. So this defaults to the heart when you first open the tool, but you can go ahead and select the other organs here. Following that, there are 3 tabs. I'll walk through what's on each of these tabs on the tool. The first tab is labeled Yield Predictors. This simply is a table showing you what's in these models. So if you were curious, what does the SRTR take into account when we're considering differences across the OPOs, this is simply a listing of those factors. All of those factors come from the UNOS data collection system through UNET, mainly things that are on the deceased donor registration form, and so you can find the listing there of what is included in those models. The second tab is labeled Model Coefficients. This provides the exact statistical model used. There's a lot of numbers on that tab that show you how the risk adjustment works. If you have a statistician who understands how to calculate these probabilities from these models, those would be the coefficients that they would want to use to do those calculations. And I'll show you a bit more in a second about how they can access those coefficients directly. The third tab here is labeled Model Element Plots. This is one I'm going to spend a bit of time on, and this is designed to show you how each factor affects the predicted yield probability. In other words, for the different levels of different variables that we take into account, which things are more likely or less likely to yield a liver if the donor has that characteristic. I'll spend a bit of time on that just to help you understand. This is an example. If you were on that Model Element Plot tab and you looked at the effect of donor age, what I'm showing you here is the effect of donor age on the predicted yield for heart. Okay, so this is specifically from the heart. If I had chosen the heart model and then looked at that third tab for Model Element Plots, you would see this shaped figure on that plot. I'm just going to highlight a few things to help you interpret this. When we build these models, we allow the models to fit curves to these functions. In other words, so from high to low, it can fit sort of any number of shapes across here to try to capture the effect of donor age. The first thing I want to highlight is for each of these plots, we have to define a reference level. So we're comparing one age to another. We typically will pick something sort of in the middle of the range. In this case, the arrow here pointing down at the x-axis shows that the reference chosen is 45. So every point on this line is going to be compared to a donor who was 45 years old. We've chosen that arbitrarily. If you just chose, say, 50 or 30 or some other number, the plot would just shift a little, but it would look the same. So we pick 45 as the reference level. That's why that purple line crosses the 1.0 mark on the y-axis right at 45, because we've set that as our reference. So we're going to compare every other age to a donor who's age 45. So for example, if we had a donor who was 25 years old, so I'm going to find 25 on the x-axis, and I'm going to go up and see where this curve sits, and you'll see that it's at approximately 2 on the odds ratio on the y-axis. So what that means is if you have a donor who is 25 years old, the odds that you would place that heart for transplant are twice the odds as if the donor was 45 years old. So the shape of this thing, you can see as you get to younger donors, the odds of placement for the heart go up. And once you get above, into the mid-40s and up, when you get to about 60, the odds are very low that you would place that donor's heart. So this helps you interpret the models. So if you were an OPO and you had a 60-year-old donor, what are the odds that you are going to place that heart for transplant? This figure would tell you that the odds of that are quite low. If you hover over the figure, you'll see the actual odds the odds ratio displayed there. So I'm just showing another example here. If we had a 55-year-old donor compared to that 45-year-old donor, the odds ratio is actually 0.31 at that point. And so the easy way to interpret that is, given that that's below 1, if I just subtract that value from 1, which is in the bottom line of the blue box on your screen, 1 minus 0.31 is 0.69. I would say this donor is a 69% lower odds of placing the heart than if the donor was 45 years old. So this is how you would interpret any point along this line. You can sort of get a sense of how the models take age into account as you study these types of shapes and these lines. There are many factors in the donor yield models that are what we call continuous in nature. That means like age. There's any number of values that it could take over a range. We're plotting here from a donor age 0 all the way to donor age 90. Not all elements in these models are continuous in nature. We do have some things like the cause of death in this example that just have a number of distinct categories. We typically refer to these as categorical predictors. In this case, you're just going to compare, again, we have a reference level, which you'll notice on the x-axis is the cerebrovascular stroke cause of death. So that point is right at 1.0. We're comparing the other causes to that cause. And so the one I've highlighted here is if the cause of death was trauma, we see an odds ratio of 1.929. Interpretation of that would be that we'll just say that's almost 2. So someone who dies from trauma is almost twice as likely to have their heart transplanted as opposed to having a death that was cerebrovascular or stroke in nature. And you can see how the other causes are there. So any of the factors in these models, they fit into one of those two groups, whether they're a categorical predictor or a continuous predictor like donor age. This is meant to give you a sense of how you would interpret how those are taken into account in the risk models. Just a quick note, the tool, if you're on the Yield Predictor tab, has a note on it about what we call rare donor conditions. There are certain things that if the donor has those conditions, the odds of placement are very, very low, but not impossible. In the data, we see certain cases where these donors indeed are transplanted. And so we want to give OPOs the credit, I guess you could say, if they do transplant those. And this is just saying how we handle that. So in this case, I'll just read the note here. Some donor conditions are too rare to allow for inclusion in the full risk adjustment model. This includes donors with the following conditions. This is for heart, whether they're hepatitis B surface antigen positive, if they are DCD, or they are hepatitis C positive. We call these sort of conditional exclusions. If your donor has any of those 3 characteristics, we assign the national probability of yield for that organ for those donors. In this case, it's 0.54%. So that's saying if your donor had any of those 3, we think the probability you would place the heart would be very, very low, 0.54%. In other words, about 1 in 200 donors. You would actually think you may place the heart. So we do see cases in the data where these are placed, and so we want to give OPOs credit for these rather than exclude those donors. But we do assign a very, very low probability that would happen. For any statisticians out there, or if your OPO has an analyst, we do make the actual model available. You can download an Excel file here by clicking on the Model Coefficients tab, and you'll just download that file right to your computer, and it has the complete model that would be needed to do these calculations within your OPO. A highlight here, so we have been rebuilding the OPO yield models this year. I'll talk a bit about that and show you where you can preview those models. These models will be used in the January release cycle coming up, January of 2018. A bit about our rebuild schedule. Our goal at the SRTR is to do a full model rebuild every 3 years for all of the models that we're building. We have a number of models, actually about 70 for post-transplant outcomes alone. And so the yield models also fit into that sort of schema of all the models that we're trying to maintain and build. So every 3 years we do what we call a complete rebuild, and that is that we reassess all of the data available in UNet. We look at the predictors. We have targeted discussions with key people in the field and try to completely rebuild them from scratch. Once we've done that, and that's what we've done now, once we've done that, every 6 months we would refit those until we get back to that 3-year cycle, and we'll take a complete look again. What we mean by refit is we just take the current set of donors nationally and we allow those risk factors to adjust such that if, you know, older donors became more risky or less risky, the shape of that curve would adjust a bit. But we're not looking to completely rebuild those models every 6 months. So we've just completed the rebuild on the OPO models. I'll just highlight a few changes. They do have more in them than the previous models had. We will be taking into account the donor's ejection fraction. We have been doing a lot of work looking at the DCD warm ischemic time, so time, what sometimes we refer to as downtime for the DCD donors. We looked at the interplay between the DCD downtime and donor age, which was a suggestion of the NPSC-OPO joint work group, so we really appreciated their feedback and their recommendations that in other words, their recommendation was that the interplay between the donor's age and that DCD downtime matters. And indeed, when we looked at it, there was a significant effect. So we appreciate that type of suggestion. The new models will also have the HIV status of the donor. With the passing of the HOPE Act, we want to make sure that we then capture the HIV status of those donors as well. You can preview those models today. We just posted this morning a preview of those new models, so you can see that highlighted here. It's right below risk adjustment models for OPOs. We have risk adjustment models for OPOs preview. If you want to go, the tool looks exactly like the one I just showed you, and you can see the changes in the models and the new factors that are in each of those models. We will, of course, answer questions. If we don't get to a question today, send us an email about those models. We're happy to address those questions. So a few thoughts about the interplay between the OPO metrics and transplant program evaluations. We're often asked this question about the interplay between them. We all, I think, would agree that the interplay between the OPOs and the transplant programs is crucial in the transplant system. So I sometimes would rather we refer to these as DSA level metrics rather than OPO metrics per se, because of course, transplant programs have a part to play in getting those organs placed as well. One of the questions we looked at is, does higher yield for the OPOs lead to worse transplant program outcome evaluations? The thought here is that if OPOs are more aggressive in going after more marginal donors, and the programs feel they must take those more marginal donors, may it hurt their performance evaluations. This is a figure that we've presented at a few meetings recently. This is showing the association between the OPO's kidney yield on the x-axis and the post-transplant outcomes evaluations for the local programs in the DSA on the y-axis. And you can see from this figure there is no correlation between the expected kidney yield and the kidney outcomes of the local programs. You may expect a positive association here if those OPOs that were more aggressive or getting those organs placed, under the assumption that those would be going to more local programs, that those programs would have worse outcomes. And indeed, we don't see a trend there, and this is after adjustment that occurs. Right? We are adjusting on the donor side for the quality of those donors. And then again, on the post-transplant side, we make the best adjustments we can for the donor quality as well there, and the recipient factors. So we don't see a correlation between the OPO performance metrics and the performance metrics of the local programs. This slide shows the association between the local acceptance behavior of the programs and kidney yield. And here there is a positive correlation, slight, but as the OPO's the programs offers acceptance ratios within your local DSA increase, in other words, moving from left to right on the x-axis. We do see higher kidney yield from those OPOs. We've looked at this in kidney for now. So this is suggesting that if you have a DSA with programs that are more willing to accept those kidneys, that actually does play along with having higher kidney yield within the OPOs. We looked at a few other metrics along this line of thinking. This was recently published. Dr. Way first authored this in Clinical Transplantation that was published just recently. This figure here shows the relationship between what we call the DSA-specific offer acceptance ratios, in other words, the acceptance behavior within your local DSA, and on the y-axis here, the kidney discard rate. And the trend line over to the right is the adjusted analysis, so I'll just focus on that. But this is suggesting that as programs within your local area become more likely to accept offers, the probability that those kidneys are discarded goes down. Also, we looked at cold ischemia time, again a similar trend on the right as the DSA level offer acceptance practices go up. The predicted cold ischemic time on the organ goes down, which is, I think, a good thing. And then we looked at also the shipping. So as the DSA-specific offer acceptance ratios go up, the kidneys are less likely to be shipped outside of the local area. So we have fewer exports. So I just encourage you to go review that paper if you haven't had a chance to see that, and would welcome your feedback on that as well. So finally, just touch on some tools that we've made available for the OPOs. I think the one that has been out there for a number of years now is what we refer to as our OPO Yield Calculator. I simply have a screenshot of it here. This is an executable program, runs on Windows. We make this available and updated every 6 months along with the new models. OPOs can download this tool. It allows you an interface to enter in the characteristics of your donor based on the model, and then it will give you the expected yield for each of the organs. It allows you to actually track a cohort of donors over time, so you can sort of track this longitudinally within your OPO. Each 6 months when we update the models, the tool allows you to import the previous data into the new tool and get updated predictions there as well. So if you have any questions about that tool, we hope it's fairly self-explanatory, but certainly reach out to us if you have any trouble either locating or working with that tool. Before I move on, I will say that we will be updating this tool to match the new models that will be used in January of 2018. So you can anticipate that this interface here will look slightly different as we incorporate more of the new predictors into those models. Then that interface would stay for 3 years until we come back around to reevaluating the model as a whole again. So you will see some changes coming up next year on this tool, but the functionality will remain the same. We've also recently begun to post what we call a kidney offer acceptance summary table. This is also available through the SRTR's secure website for the OPOs and the transplant programs to view, and this simply shows a ranking of programs based on their proclivity to accept kidney offers that we would typically refer to as harder to place offers. So the tool has a number of tabs on it, starting from the left here, the high KDPI kidneys. So we show for each of the transplant programs how many offers they received for those, how many they accepted, and then we have offer acceptance ratios there showing which of the programs have taken a lot of those types of offers and which of those programs tend to take fewer of those offers. So the different tabs here currently available, we have the high KDPI, we have PHS increased infectious risk donors, the DCD donors, the HCV positive donors, and then those donors that have already gone through 100 offers, so we're the over 100 offers. We have a listing there showing you which programs take a lot of those types of donors. So we've heard positive feedback about this tool, that OPOs have enjoyed being able to see the different programs in context of one another and their recent history with accepting these types of offers. We have worked on offer acceptance models for the other organs as well, and we're hoping to roll those out in 2018 as well. So this tool would expand. Right now you only have in the blue bar at the top the kidney offer acceptance practices. We will expand this to include the other organs as well as we have them available. But we're hoping we will have kidney, heart, and we will have kidney already. We will have heart, lung, and liver in early 2018. With that, I will stop. I wanted to try to leave about 15 minutes of Q&A time. So we've been having a number of questions come in, and I have Mona Shatter here with me, who is our marketing communications specialist, and she's been monitoring the questions as they came in. Again, if you type them into the Q&A box, we can get to as many as possible in our remaining time. So.
All right, thank you, Dr. Snyder. The first question we have is, when could we expect a server version of the Organ Yield Calculator? Currently, it's difficult to share data.
Good question. We've had internal discussions about ways to make that tool more accessible. I do know that a number of OPOs have, or the OPO record providers like LifeLogix or StatLine have built the tool into their electronic system so that when the OPOs are entering donor information, some of those calculations can be made within that tool, so sort of getting out of the need to use the SRTR tool. I'd be curious how many OPOs, have trouble with the tool. It only runs on Windows, for example. There are ways we could explore to make that more user-friendly and more accessible. Currently, we have no plans to expand beyond the type of tool we are putting out today, but certainly we could take that type of feedback back to HRSA and see how they would prioritize that type of effort for us to make different types of versions of it available for different types of users.
Thank you. Our second question is the OPO Yield Calculator available to transplant centers?
Sure. It's contained within the SRTR secure website. We have given that to other transplant programs as interested in the past. So certainly just provide us a query through our email. Our best way to reach us is srtr@srtr.org. That email address, or there's a contact us function on the website. If you just simply contact us, let us know that you'd like to access that tool. Happy to provide it to you.
Our next question is, will the tool with the preview data allow missing fields? We won't have HIV and EF for all data. How can we look at the previous cases?
You'll see in a number of those values, in those variables, in those new models, there are missing levels for a number of them. So those are indicated on those models. But certainly if you, I'm hedging a bit because it depends on certain elements how that's handled. Sometimes we have cases where are there evidence, was it reported as HCV positive, for example, versus other, in other words, HCV positive versus either negative or not measured. And so it depends on the element, but you'll see in that listing of those models how each of those are handled. If they have a missing level, it is explicitly indicated there.
Our next question is there a way to upload data into the Organ Yield Calculator as opposed to manually entering each donor?
Yes, there is. There is an import feature in the tool. We actually also can provide to the OPOs I think it's there automatically, a input CSV file each time we release the 6-month data to the OPOs. There's a import file that is made available with those calculators that can import the current data in, and then if you had other data you wanted to import in, you can do that as well if it's in a similar format to that import field. So yes, it's possible. Just certainly shoot us an email if you have any trouble with that feature.
Okay, our next question is, do the transplant centers have calculators?
Not currently. We do make all of the models for the, as I mentioned, 60, 70 plus post-transplant outcomes models along with the waitlist models themselves. All of the models are available on the SRTR website. However, we haven't gone that step to create calculators for the post-transplant metrics or the pre-transplant metrics on the transplant program side. I'd be curious if the community would find that useful. Certainly we're open to putting out useful tools for the community to use, so I'd certainly welcome that feedback. I know that folks have taken certain models. You can download the coefficients for the post-transplant models, and if you have a statistician that can design a calculator, the formulas are all there ready to go, but we don't have a tool explicitly available. The history of that, by the way, is in about the 2010 time frame, the OPO committee had made a formal request to the SRTR for a tool that would allow them to evaluate their organ yield. That was during the time when the MPSC was beginning to entertain the idea of monitoring OPO performance using the yield metric. And so that spurred on the creation of that tool for the OPOs that has been in existence since late 2010. Certainly, I think we're going to stop there with the questions. If there are more questions that you have that we weren't able to get to, we'll do our best to respond through email. And again, we always welcome any feedback with any of the tools. If you have follow-up questions, feel free to email us. And thank you all for attending, and I wish you a wonderful day. Thank you.